Well, Randy, the death of this 9-month-old in northwest Minnesota in Clay County is considered by the health department as one of the youngest COVID-19 related fatalities in the entire country. And as Children's Minnesota is reminding people tonight, although it is rarer for children to see severe symptoms from COVID-19, it doesn't mean that there's no risk. In Minnesota, nobody younger than 20 had died of COVID-19 until this week.
This news of an infant dying of COVID is really startling.
Children's Minnesota nurse practitioner Patsy Stinchfield says the 9-month-old's death is a reminder that kids can, on rarer occasions, come down with severe symptoms.
What they're presenting with is A to Z. So we have some children that come in, they just have fever and sore throat. Some may have a runny nose and cough. Others, especially older kids, we're seeing, I can't smell or taste. I have a severe headache. I have bad body aches.
Children's Minnesota reports so far 7,000 kids tested and 343 positive COVID-19 cases, 54 admitted to the hospital, and 13 admitted to the ICU.
We know that kids of all ages can get COVID. It's not zero that this can happen.
But kids do make up a much lower share of positive cases and deaths. That's why Minnesota's health experts are sending information to the CDC about the Clay County 9-month-old who died without any underlying health conditions.
We want to make sure that any information that's available on the course of this infant's illness is added to the broader understanding of infant deaths across the country.
There's still a lot we don't know about COVID-19 and why kids don't seem to experience severe symptoms as often. But according to Children's Minnesota, underlying conditions make them higher risk, just like adults.
Sometimes they present where those underlying conditions are worsening. So increased blood sugars for diabetics, more seizures for kids with epilepsy. So paying attention to that is really important.
And another reminder from Children's Minnesota tonight is that if you have any kids that experience any symptoms of COVID-19, you should be calling your doctor immediately so they can walk you through the testing process. They don't want people to just sit with that information and not report it. Back to you.
Absolutely. All right. Thank you, Danny.